Hey everyone, we're looking at the mandible today. Alright, so with the mandible, we have two major sections. The body of the mandible is more robust, kind of horizontal if you think about it that way. The ramus is this section that looks like it's been pinched up. It's a lot thinner, kind of more vertical. So body, ramus. The projections off of the ramus and the back of the body are the angular process, kind of like the jaw line, the back corner. This is where it actually physically attaches to the cranium. That's our condyloid or condylar process. Very smooth again for smooth movement. You're going to see that in a lot of joint and socket areas. With the condyloid process, that is what articulates with the mandibular fossa of the jaw. The coronoid process, corona referring to a crown, think of it as the crowning part of the mandible, the highest point. The foramina of the mandible are the mental foramina, which are lateral and closer to the front, closer to the canines. And the mandibular foramina are these two holes here. So you have a mandibular foramen here. There we go. Mandibular foramen on the back medial side of that side of the jaw. The two halves of the jaw are joined at the mandibular symphysis. And if they do come apart, you're looking for a broad, flat area. So if you're not sure which side is which, looking at your jaw, look for that broad, flat, textured area where the two jaws, or the two halves of the mandible would be joined together. Like that. You can also use, for orientation, this is medial, the mandibular symphysis is medial, the mental foramina are lateral. That can also help. For the teeth, we have, just like in humans, at the very front, the incisors are little sort of scraping teeth. Canines, much longer and more pronounced in a carnivore. We have premolars, which are kind of more jagged but thinner slicing and dicing teeth. And in cats are obligate carnivores. They do not have lower molars. They do have one little teeny weeny molar on the upper jaw, which has a flatter surface for chewing and grinding. So a fox has many premolars, kind of the narrower profile. And then they have some flat surface grinding teeth, the molars back here. Any space between a tooth is a diastema.
Hi everyone, today we'll talk about non-mammal tetrapod mandibles. So our exemplar mandible here is the alligator. The first thing we should note is what position we're in. So we're looking at the labial view of the mandible. So when we talk about mandibles, we're talking about, people usually orient them with labial or lingual views. So the labial view is the lip view, labial means lip, and lingual would be this view. I'd switch it around, but I don't want to bother with that. Is the lingual, it means tongue. Okay, otherwise we could say lateral and medial, but it's just normal to say labial and lingual. Now in the labial view, the majority of the mandible is actually a single bone right here that bears the teeth. It is conveniently called a dentary, or dentary. That is the same thing that is homologous to the entire mandible of a mammal. Mammals are kind of weird in that respect. But anyway, the dentary is the tooth-bearing bone of a non-mammal tetrapod and fish, for the most part. Now, as we move posteriorly, there is this bone that makes up this angle that moves back. You can see the suture for it here and a little bit of it right here. So that is the angular, conveniently enough. It forms the angle. And then above the angular, we have the surangular. It means above the angular. Ah, so convenient. All right. Now I'm going to switch it, so we're looking at the dorsal view. This bone right here, it has a hole in it because it was mounted to a skull. You can kind of see it a little bit better this way. There's the suture right there and here. That is the articular. That articulates with the quadrate in the back of the alligator skull. So like this, here's the articular and here's the quadrate. It does, you know, some of these like that. I looked like it was talking, that's great. And we'll switch over to the lingual view. Okay, so we got our articular back here. Here's the rest of the angular. There's the surangular up there. We're just seeing it for the opposite side. This bone, though, is a little bit different. This is the coronoid. So the coronoid, you know, you've seen the coronoid process. It's just kind of near the crown, the top of the mandible. In crocodilians, it doesn't do a whole lot. It's just kind of there. There is a muscle that attaches to it, but the majority of croc jaw closing, motion muscles are attached on the sides, attached here and back here. So they don't have a very large coronoid. And then the splenial, which is actually one you don't need to know because of a faux pas on our part or something along those lines. It's right here. It's just a very thin sheet of bone along the lingual surface of the mandible. Now here is an iguana. The dentary is here, has our teeth. That's the iguana's teeth. So the angular is here, and the articular is very, very large. It makes up a large portion of the posterior mandible in the iguana. That's a little unique compared to the crocodilian, but such as biology. The surangular right there, and then this thing. This is actually the coronoid, which we can see from the lingual surface. Labial surface, and if we switch it to the lingual surface, you can see it even still. It's got a very large process because it is used in jaw motion in iguanas, much more so than in crocodilians. More similar to how mammals will use their jaw closing, resulting in this type of projection. And I guess one last thing is the splenial is right there, and that is it. There's a very large articular. So, all right. That covers the non-mammal mandible. So take care, everyone. See you next time.